Polycystic ovary syndrome. PCOS is a very common hormone problem for women of childbearing age. Women with PCOS may not ovulate. They have a high levels of androgens and have many small cysts on the ovaries. PCOS can cause missed or irregular menstrual periods, excess hair growth, acne, infertility, and weight gain. So I have three that I would like to present. I would like to say that the first one is by Ikram Mansour. And I have a disclaimer. I am in his paid group, and we are not allowed to share that information. This is not from that group, just so that you know that. His protocol is CTMT, and this is what that stands for. On day 1, you have carcinosum CM, a single dose. On day 2, you have tuberculinum Koch CM, 1 dose. Day 3 is medorrhinum CM, 1 dose. And day 4 is thuja CM, 1 dose. And he will often say that you can repeat these CM remedies once a month if you're still in need of them. Starting on the 5th day, you take Apis mellificus 3 times a day, 30C. Apis mel, 30C, 3 times a day. The next one is a post that was posted by Fawad Hussein, and his goes as follows: medorrhinum 1M, 1 dose a week. Thuja 1M, 1 dose a week. ACTH 1M, 1 dose a week. Now, from what I understand, ACTH is a hormone that's secreted by the pituitary gland, which stimulates the cortex of the adrenal gland to produce more cortisol. Okay. The next one, still on that list, is Apis 30, 3 times a day, and Podophyllum, PODOPHY, double LUM, Podophyllum 200C, twice a day. And the last one for him is Aurum muriatic natronatum. Aurum, I think is what it goes by. 30C, 3 times a day. Okay. Now, here is the Banerjee homeopathic protocol for PCOS. First is a dose of Conia Mac 3C at the same time with Sepia 6C. And you do that combo twice a day at noon and at night. It also says that if you're over 40, add the following: 1 dose of ammonium carbonicum 200C once every other day. And just remember that remedies are always taken separated by at least 10 minutes unless you're specifically instructed to take any 2 together. That's all that I have for you folks. Normally, I do try to find some rates, remedy rates that would apply to the topic at hand, and I was not able to find any. If any of you are aware of any, do please let us know. Dr. Imran, that's it for me. You can go ahead.
Okay, thank you very much.
You're welcome.
Bismillah ar-Rahman ar-Rahim. Good afternoon, everyone Here is Dr. Imran from Pakistan. So today,
Dr. Imran, did we lose you?
everyone hear me?
Okay, I hear you now.
Okay. So today we are talk about PCOS. First is, what is the symptoms of PCOS? Irregular periods, delay periods, snatty menses, heavy periods, acne, pimples, hair fall, weight gain, skin darkening, mood swings, irregular periods that from absence of ovulation due to which the lining of uterus is not shed every month. Delay periods, amenorrhea, absence of menses for 3 or more months. Female with this may have less than 8 periods in a year. Heavy periods. As the periods do not regular, it result is building up of uterine lining for long. When the periods, they can be heavier than normal. Acne and pimples. Measure due to elevated male hormones that cause skin to become oily. Acne may on face, chest and back. Hair fall, hair thinning, tendency to gain weight. It is noted to around 80% of these cases, and obesity. Mood swings, irregular and headache may be complained by some from hormonal changes. These signs and symptoms will have to supported by hormones test and other medical investigation for proper diagnosis of PCOS. The main test is an ultrasound which shows the presence of cyst, fluid-filled scales in ovaries with the enlargement of ovaries. Next are hormones tests such as FSH, LH, prolactin, and progesterone. So what is the cause behind of PCOS? The cause for PCOS is still not clear. There are a few factors, however, that are believed to play a role in it. First, it is considered a disease of genetic origin. A woman with a positive family history of PCOS is at high risk for developing the same. Second main factor is excessive production of male hormone androgen by the ovaries. Third, next is insulin and excess of insulin or hormone produced by pancreas that help body cells to use sugar for energy. In case cells get to insulin, then there is an increase in blood sugar levels. This makes the pancreas to produce more insulin. The excessive insulin in turn trigger ovaries to produce more androgen. Fourth, another factor is low grade inflammation due to high androgen levels. Fifth, weight gain and obesity and inactive lifestyle are other factors. Now we are talk about some homeopathic remedies which we are used in our clinical practice. First remedy is Pulsatilla nigra. Pulsatilla nigra is a natural remedy sourced from plant windflower. It is the top most remedy for treating PCOS. The foremost issue that it can help with is irregular and late periods due to hormonal disturbance. It is indicated for cases where periods happen very late, later than the expected date, and menstrual flow is also snatty and may be dark and thick. Menses can be painful as well. Beside, it is wonderful remedy to treat acne associated with menstrual irregularities. And patient always want to cry. When and how to use Pulsatilla nigra? Pulsatilla is a high recommended remedy for cases of hormonal disorder in females. The remedy is suggested in cases of irregular menses and where tendency for late periods is there. The remedy helps to regularize menstrual cycle and aim to bring periods on the right time. The potency of this remedy differs from case to case, from low to high. Low potencies like uh, 1x, 2x, 3x, 3C, 6C, 30C, and then we are go to 30C, 200C, 1M, 10M, 50M, according to the patient condition. So next remedy is sepia. Sepia is the next most effective remedy to help cases of hormonal imbalance which result to ovarian cyst. Most prominently, it is action is to regular hormonal levels to regularize the menstrual cycle. In general, females needing it have tendency of late periods with snatty blood flow. A very symptom present in is a bearing down sensation in pelvic region, as if pelvic organs will be pushed out of vagina. CPI is indicated to manage complaint of fecal hair. Hair growth is mostly noted over upper lips and chin. CPI is also leading remedy to treat infertility in females Lastly, CPI is recommended to manage cases of skin pigmentations. So we are use CPI 30C, 200C, 1M, 10M, 50M, CM according to the patient condition. So third remedy is Calcarea carb. Calcarea carb to manage weight gain and heavy periods. Calcarea carb is an important remedy when it comes to manage problem of weight gain. This remedy control excessive weight gain. Other than this, it is an excellent remedy to manage heavy periods in PCOS cases. The duration of periods may be also be prolonged in cases needing it. There may be extreme sensitivity to cold air. So we are use Calcarea carb in 3x, 6x, 30C, 200C, 1M, 10M, 50M according to the patient condition. Fourth remedy is Natramure. Natramure for managing hair fall and hair thinning. Natramure is an ideal choice of remedy to manage cases of hair fall. It will control further falling of hair in such cases. Apart from this, it is also indicated to treat tendency to have late periods. It can manage sadness, headache, restlessness, tiredness, irritation due to PCOS. We are use Natramure in 3x, Natramure in 6x, Natramure in 12x, Natramure 30, Natramure 200, and Natramure 1M according to the patient condition. Next remedy is Hepersulf. Hepersulf manage your pimples with this remedy. Hepersulf is an outstanding remedy when it comes to managing pimples, acne. It works very well in cases of acne, contain pus. These are attended with the prickling pain. Sometimes blood may ooze from pimples. So we are use Hepersulf in 30C, Hepersulf in 200, and Hepersulf in 1M according to the patient condition. So next remedy is Oleum jacoris. Oleum jacoris, Oleum jack. So we are use Oleum jack for managing hair growth on face. This remedy highly suitable when it comes to treating excessive hair growth on face. It gives good result when hair growth on chin or upper lip. The hair may be thick. This remedy has great ability to check unusual hair growth on a woman's face. So Oleum jacuraris, we are use this remedy in mother tincture, empty, and 1x, 2x, 3x, 4x, 5x, 6x, 7x, 8x, 9x, 10x, 30C. I see this remedy giving a good result in a low potency.
Dr. Imran,
Next remedy, yes.
when you say facial hair, does that cover women in menopause? You know how women in menopause tend to get whiskers?
Yes,
Will
yes.
that remedy help that situation?
Yes, next we are used with Oleum jacuraris and Thuja and sepia. So next I share a whole combination, a protocol for this issue.
Ah, okay.
Right now I just talk about a single remedies. After that I share.
Great, thank you.
So someone asked for spell OLEUM Oleum space JECORIS. So next remedy is Kali Carb. Kali Carb we are used when periods are late by several months. Kali Carb is a very helpful remedy for cases in which periods are missed for several months, say 3 or more together. When periods come, they are heavy in nature. It is attended with backache before periods, colicky pain in lower abdomen may be a felt. So we are use Kali Carb in 12x, Kali Carb in 30C, Kali Carb in 200C according to the patient condition. So next remedy is Thuja. So Thuja we are using for hair growth on face and skin pigmentations. So Thuja is prepared from fresh twigs of plant. Arbor-wide use of remedy is highly considered to manage excessive hair growth on face. Next, it is applicable to manage skin hair. It is used for brownish discolor on skin. So we are use Thuja in 30C, in 200C, 1M, 10M, 50M. So most of the time I see Thuja always work in high potency like 200, 1M, 10M.
Dr. Imran, can I ask you a question? on this
Yes,
remedy.
please.
Is the brown discoloration, how would you tell the difference between, let's say, like liver spots? Like, it doesn't matter what kind of brown discoloration you're looking at or where it is, maybe?
No, if due to a liver issue, then we are used first the liver remedies, like cardas,
Right, but is there a way
card.
to distinguish like what you're looking at? Like maybe the location of it, or does it matter?
No, if support on face due to liver, then we are use chalidonium, cardus miranus, bryonia. Then we need to add a liver remedies.
What she wants to know is how do you tell the difference whether it's melasma or liver spots?
Because both of a color is different. And due to if melasma, then skin color is different. And if due to liver or due to kidney, then skin color is different. So most of the time we see melasma color is like a blackish, but if a liver damage or liver disease, then skin color is like some yellowish. So then we need to add some remedies for liver.
Thank you so much for explaining.
Uh, always welcome. So next, I want to share some remedies for infertility. Okay, yes. So if infertility due to acid vaginal discharge, then we are use borax and natrum as a top grade remedy for infertility in females due to acid vaginal discharge. These remedies for infertility in females are used where the vaginal discharge are acid destructive and kill the sperms. Borax is a remedy for infertility in females when the vaginal discharge is like the white of an egg, copious and warm. In such cases, easy borax is the best remedy. Next remedy, natrum phase, is indicated for infertility in women who have acid irritating creamy, honey-colored vaginal discharge. So we are use this remedy, Borax 30C, Borax 200, and Natrum Phos 3x, Natrum Phos 200, Natrum Phos 3x, Natrum Phos 6x, Natrum Phos 12x, and Natrum Phos 30C and Natrum Phos 200C according to the patient condition. So next we are talk about infertility due to prolonged periods. Calcarea carb and Elatrus farinosa. Calcarea carb is mainly used when a female with infertility has to profuse and too long lasting periods. The periods also appear before time. So we are use calcarea carb in low potency like 3C, 6C, and 30C. So next remedy is Elatrus farinosa. The main symptoms are early and copious menses with infertility, leukorrhea, anemia, weakness, tiredness, and fatigue may also among these remedy for infertility in females. Elatrus farinosa is also suggest where a tendency for frequent abortion in present. So
Would you,
Elatrus farinosa,
would you spell
we
that
are,
one for us?
1 second, I write. Elatrus farinosa. So we are use this remedy only in mother tincture and 1x. So I always start this remedy is 10 drops 3 times a day in mother tincture. This remedy make with the American grass. So third, infertility in females with short and snatty periods. Pulsatilla and CP are useful remedy for infertility in females resulting from short snatty periods. Pulsatilla is a natural remedy for infertility in women who have faced menstrual irregularities since the menses always get delayed and never appear on the expected date. The menstrual discharge is also snatty and remains for a very short time. Pulsatilla is also top the list of remedy for infertility in females suffering from PCOD. So I always use this remedy in mother tincture, 1x, 3x, 3C, 30C, and 200C and 1M according to the patient condition. So for delay periods, I share a combination Pulsatilla nigra in mother tincture, Pulsatilla nigra in mother tincture, Ashoka in mother tincture, and gossypium in mother tincture. We are use mix these three mother tinctures, Ashoka, gossypium, and Pulsatilla nigra. Mix together these mother tincture and use 15 drops 3 times a day in half cup of water. So if heavy bleeding, so periods come every 15 days, 10 days, periods come early in mid of a month, then we are use Murex 30C, Sabina 30C, and Calcarea Carb 30C. Murex 30C, Sabina 30C, and Calcarea Carb 30C. Mix together these three remedies and use 3 times a day. So next protocol is if infertility in females with decreased sexual desire. Agnes and CPR prominently indicated remedy for infertility in females with decreased sexual desire. Among these remedies for infertility in females, Agnes castus is used when to sex is there, excessive masturbation may be a cause behind this. The genitals are also relaxed with transparent vaginal discharge. So we are use Agnes castus is in some cases I use this remedy in mother tincture, and some cases I use this remedy in higher potency like 200, 1 m and 10 m. Sepia is also used for infertility in females having low sex drive. The vagina may be excessively dry with pain while intercourse. Bearing down sensation is also marked feature that may appear. So I use most of the time if in female patient have low sex drive and after sex feel irritation, sadness, headache, backache. So I always use sepia 200C or in some cases sepia 1 m. So next we are talk about if infertility in females due to non-retention of sperms. So Nectrum card is top grade remedy for women who have non-retention of sperms, offensive and irritating vaginal discharge may also be present. So Natrum card if I talk about natrum carb, so natrum carb I always use in high potency. Natrum carb in 1 m, natrum carb in 10 m, natrum carb in 50 m, and natrum carb in cm. Uh, in 99% cases, I use only one dose. I suggest only one dose. If I give a 1 m, 10 m, 50 m, so I suggest only one dose.
Dr. Imran, can I ask you to clarify the reason to use natrum carb? Did you say retention of sperm or low retention? I didn't catch that.
1 second. I talk about we are use natrum carb infertility in females due to non-retention of sperms. So now we are talk about some remedies for infertility in in males. So when we treat infertility cases, I always suggest to male for sperms semen analysis test. So infertility in males due to erectile dysfunctions. There are some top grade remedies for infertility in females from erectile dysfunctions. First remedy is Agnes Costas. Is best pickup when both sexual desire and physical ability are lacking. Genitals are laxed, ability are lacking, are laxed and cold. So we are use Agnes. Most of the time I just give one dose of Agnes castis in 1 m. So next remedy, Caladium seg, Caladium, Caladium seg. Caladium seg is also best choice for impotency when mental depression, sexual desire is present, but the genitals are lax with weak erections. So I suggest Caladium seg 1 m only, one dose. So next remedy is selenium, Selenium, selenium. Selenium is also best choice, the various remedy for infertility in males from erectile dysfunction. Selenium is helpful for slow, weak erection with rapid emissions. Involuntary semen discharge may also be present. So I always use selenium in 3x, selenium in 6x, and selenium 30C and selenium 200C according to the patient condition. Infertility in males with low sperm count. So X-ray is top grade remedy. X-rays is top grade remedy for infertility in males for a low sperm count. It helps to increase sperm counts. It helps in both improving the quality and quantity of sperms. So I use only X-rays in 30C once a day. So next we are talking about infertility in males with orchitis. Conium is top grade remedy for among the chart of remedy for infertility in males. It is used when the testicles are swollen, hard, and enlarged. It is also offensive when a history of suppressed sexual desire is present. So conium I only use in 30C and 200C. So next, infertility in males with wasting of testes. So sebal sarolata, or sebal sarolata is top grade remedy for infertility in males with wasting of testes. It is also the perfect remedy for infertility in males with prostate enlargement. So I use Sebelsar only in mother tincture. So Sebel Sarolata in mother tincture, 10 drops, 3 times a day. So now I want to share a protocol for erection. Lycopodium 200C, Agnus castus 200C, Caladium sep 200C, acid fast 200C. Mix together these remedies and use once a day.
What was the fourth one?
Acid fast.
Can you spell that?
Acid fast, ACIDPHOS.
Ah, acid phos. Okay, thank you.
Yes. So anyone have a question about this topic? So I'm here to
Yes,
answer.
Dr. Imran, I can add one thing. Perhaps you forgot this elatrus for the women.
Yes, I already talked about this remedy, Elatrus farinosa.
Perhaps yes. And what about nofolatum, ginseng, damiana for the male?
Yes, these are also good remedies, but I just shortly talk about male remedies only for related with infertility. So, nephalotum,
Yes,
dimana,
good. And for the
nux,
prostate,
nux,
you have
nux.
explained about the sebal cerulata, but you have not
Yes,
explained about the chimaphila.
no, I don't talk about prostate. Sebal cerulata, I just talk about if infertility due to loss of testes, then we are use sebal cerulata. So for a prostate gland enlargement, we are use so many remedies like sebal cerulata, solidago, chemafila, thuja, conium, bretacar. These are a lots of we have a lots of choice of remedies. So here is I just talk about so some remedies which are related to our topic. So next in future maybe we are detailed talk about erectile dysfunctions, prostate. So deeply we talk about this topic.
Dr. Imran, what the 4 remedies that you gave with lycopodium, what was it specifically for? If you could repeat, thank you.
So I suggest this protocol for erectile dysfunction also. So Lycopodium, Agnus castis, Cladium, and Acetphos. Mix together these 4 remedies and use once a day. Yes.
Dr. Imran, I have a question, please. Do you have a protocol for insulin resistance due to PCOS?
Say again, please.
Do you have a protocol for insulin resistance due to PCOS?
Yes. So we are use insulinum 30C and pancreatinum 30C. Alternate these 2 remedies. Insulinum 30C in the morning and pancreatinum 30C in the evening. And in such type of cases, a constitutional remedy is also helpful if patient body structure like a apple, like a guava, if patient want to cry, if patient always angry, so we are using sepia. And if patient always want to cry, then we are add uh, apple satilla nigra. If patient body structure look like apple, then we add a calcarea carb with these remedies.
There's a question in the chat. Is it common mixing metallic mother tincture remedies with plants?
Just a minute. First remedy is insulinum and second remedy is pancreatinum.
Ahava, do you want to repeat your question?
On the chat, Teresa is asking, is it common mixing metallic mother tincture remedies with plant?
Do you understand the question, Dr. Imran?
Can you explain more about this question?
Metallic
Madam,
remedy.
Madam, if you will write this question from Mr. Imran, it's better.
It's written in the chat. I was just saying it out
Just-
loud for
It's
Teresa.
just because the plant, the metallic has a deeper grip or stronger than the plant. I never heard of it being mixed together. I heard of giving sabal mother tincture and then alternating with thuya or lycopodium or things for cancer or this fertility. But I never heard of someone mixing like palladium, so a metal together with plant. That was why I asked the question, because I don't work in the field. I didn't know it. So, okay, thank you.
Yes, we are working in this field and we are mixed because before about caladium, we are mix only with the potency in 200C, caladium sag in 200C. And caladium sag is not a metallic. And if you talk about a plant, about Sabal sarolata or Chimaphila or Solidago, we are mix these three mother tinctures. Mother tincture is a homeopathic based mother tincture. When we make a mother tincture, then we follow the two rules. One is a decimal scale and centimal scale. So you are talking about the natural plant. So I don't know about the natural plant. I just know about the homeopathic formulation.
Yes, Dr. Imran, simply you can answer the question that we can mix all these things together. Especially this Sabal sarolata Chimaphila we used to mix, and Alatris Ashoka gossypium for the female.
Yes, for the females. Yes, with homeopathic, we are mix these and there is no problem and no issue because the last 20 years, so I practice this way and cure so many patients. So Ashoka, Gossypium and Pulsatilla, these are a combination of remedies, a wonderful result. For I cure so many patients prostate cancer with Sabal sarolata, Chimaphila and Solidago combination. So I always mix these three myrrh tincture and giving a very good result.
Dr.
So
Imran,
anyone, yes, please.
I have a question with infertility for women and follicle stimulating hormone. Do you have any suggestions for that?
Say again, please.
Sure.
Your voice is breaking a little bit. So
Okay, sorry. Can you hear me okay?
yes.
Okay. Follicle stimulating hormone for infertility with women, like as the cause, meaning that they get maybe a regular period and don't have so bad symptoms, but for whatever reason, the follicle stimulating hormone is not functioning and the eggs aren't being produced.
Okay. So Alectrus farinosa, Ashoka, Pulsatilla, and Gossypium. These are four mother tinctures. We are use these type of cases. And
Dr. Imran, perhaps you are
can,
forgetting this MSC, Murex Savannah
sorry,
Calcarea Carp.
one second. Murex 30C, Spina 30C, and Calcarea car 30C. So these three potency of set and other one four myrrh tincture of set of the myrrh tincture. So regular use, so 99% cases cure with these two protocols.
Could you just repeat? You said the first one, I got Ashoka, Pulsatilia, and
Gossypium, Gossypium. You also research about the your practice way. So Ashoka and Gossypium is top grade remedies in naturopathy.
okay, so it was three of them that you mentioned, Ashoka, Gossypium, and the first one?
Alectrus farinosa, Alteris, Alectrus space Farinosa, Alectrus farinosa. Okay, so one more thing in these cases.
Yes,
So
we had
if
given the name for this gyno.
one second.
Dr. Imran, when we
So
used to go for the camps, we had given the name gyno, and we used to
it's
mix
it's
all
okay,
these mother tinctures
no
in a
problem.
big bottle.
So one second. So if a previous history about trauma, any type of trauma, so then we need to add agnesia. If patient in agnesia Mara stage, then we give some doses of agnesia. If in patient history have in these cases must talk about miasm, must need try to find about miasm, about family diseases. So some no-sod also help, like tuberculinum, carcinosum, medorinum, cephalinum. So no-sod also help. But we must have a history of family diseases from mother side and father side. So anyone have another question about this
Yes,
topic?
there is one question, Mr. Imran. Can you cure and give treatment to any person, male person, who has not the sperms? That
Yes,
he has these dead sperms.
yes. If sperm count is 0%, I cure 3 patients in my a whole practice. I almost attend 10 plus patient, but 3 my patient is cure, 7 is not cure. So if sperm count is less than 10, then patient is difficult to cure. If count is above 10, so easily cure. But I cure 3 patients uh, who have just 0% count.
But I think that if the spermatozoa test will show you that there is 0% of the sperms, you cannot cure the person. It's not possible. But as
We
you
are
said, if
we are
there are
we are
10% of the spermatozoa test shows about this, that there are 10% of the sperms, then you can cure it easily.
we are
Otherwise,
we are
it's
we
not
are
possible.
we are cured. Yes, you said it's not possible. So in homeopathic, everything is possible. I say in homeopathic, everything is possible because we are
Even
not
even
talk
the
about we are
even the
not talk
sperms are
about
0%.
yes, yes. Tomorrow you must visit in my clinic and I show you about patient and about patient
No,
feedback.
perhaps, but I haven't seen in my life because you know I'm doing this practice since last 40 years, but I haven't seen any person who was cured who had 0% of the sperms.
It's your fault. It's not a homeopathic fault. We always a homeopath is fail, not a homeopathy is fail. Just remember this. Something we
No, I'm not
miss in
talking about the
history.
homeopathy. I'm talking
Yeah,
about my practice. Yes,
yes.
perhaps you are right.
So it's a homeopath failure. It's not a homeopathy failure. So something we need to we are missing. So I always so mumps. I always ask about mumps. Mumps history and other family diseases. So in such type of cases, if you want to cure your case, you must read about nosode. If you give Damiana, Agnes, Ashwagandha, Califas, Zincum sulf, Zincum metallicum, these all are remedies is good, but not work always in such type of cases. You must need to talk about, you need to find some nosode for this patient, and I hope these helpful for you. So anyone have a question about this topic? Because already 1 hour plus. Anyone have a question about this topic? Otherwise, we leave.
There are some in the chat. Let's see here. Teresa says, do you also take into account the patient's energy level in determining your prescription strengths?
It's not related our today topic. So
Okay,
next we talk about this topic because better we are talk about PCOS or
right.
related with our topic.
Okay, let's
So
see. The next question is, what is the protocol for black hair on the chin? I didn't understand. From Barbara.
okay, I think she want to know about if someone have hair on chin. So first remedy is Oleum jacoras, OLIUM, Oleum jacoras, and second remedy is Thuja 200C once a day, and Sepia 200C once a day.
Thank you. The next question is,
Yes, Oleum, 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 JECORIS, Oleum jack in mother tincture, Thuja, THUJA, Thuja 200C, and Sepia 200C.
Those are taken separately or together?
Yeah, separately. Sepia,
Once a day?
yeah, once a day, once a day.
thank you. The next question is, how do you take into account when they take antidepressant drugs or others on a daily basis that decrease the sperm count?
Okay.
I guess Teresa's question is, how do you take into account when they take antidepressant drugs or others on a daily basis that could be contributing towards decreased sperm count and implement homeopathy with it? I think someone's
Corina Lucian. There you go. Good.
So antidepressant drugs in allopathic or homeopathy remedies?
I'm assuming she's talking about allopathy.
So we are just giving a homeopathic according to the patient condition, according to the symptoms. If a patient is suppressed, depressed, then we need add some remedies, antidepressant or so stress remedies like aconite, staphysagria, sepia. So according to the condition, which remedy. So we need to add and other remedies for low sperm count. So any other question? Okay, now I want to say thanks to everyone. So next Sunday, same time, we meet coming Sunday with new topics, same time. And
Mr. Imran, if you'll tell us about the next topic, that's will help us.
next topic later we decide and we post and send a link to everyone who want to attend.
Thank you very much.
But not now.
Dr. Imran, is it okay if I share a couple of
Oh,
natural?
yes, please. Sorry. Yes, please. Sorry, I just
No, it's
forgot.
fine. This was amazing. This is great information. Thank you. Thank you so much.
Yes, please. Yes.
Okay. So I'll just quickly say, I know we've been on for a while, that there are 5 plants that can help balance hormones. There are more actually, but some of the common ones are chasteberry, evening primrose, yam, black cohosh, and shatavari root, which that one I haven't used so much, but I have used some of the other ones. And I also really enjoy, I'm going to post here in the chat some things, but I also use something in my practice called DIM. It might not show up, I'm not sure. Let me see. No, I think it's because of the thing, it blurs out, but it's called DIM plus. And this it gets rid of excess estrogen pretty fast. So this is something to consider. It's made from broccoli, and it's called diindolylmethane. So I really, really like this. Within a couple days, people will notice a difference. I also like to use an essential oil. It must be therapeutic grade, not like it cannot be too low in therapeutics. Like if it's been distilled too long and it's very sweet smelling, it's probably not the good kind. So just make sure that you get a very good therapeutic dose. But clary sage is one that's also very, very good. You can rub over the abdomen for menstrual cramps, and it also helps balance hormones for infertility. And the French did that with essential oil, clary sage. So that's how we know that. And I also use wild yam. This one is called Progesterins Plus. And this is a natural way of, you just rub it. It's like a serum. You rub it on your forearm or on your inner thighs. And this is very helpful also for balancing testosterone. Also the chin hairs that grow here, that helps support that. Digestion, I always go back to digestion. Digestion is number one cause. We always look at that because if you balance out your digestion, you usually balance out your hormones. I mean, of course, there could be other issues that are at play, but most likely if we balance out digestion, then hormones will follow, versus sometimes within naturopathy, chasing hormonal balancing without addressing the digestion. Sometimes PCOS can be from prolonged elevated levels of testosterone, among other things, and high levels of cortisol over an extended period of time knock out the endocrine system. And they can contribute to adrenal gland fatigue. And so another way to balance out that cortisol level and hormones is by herbs that help reduce stress, like ashwagandha and L-theanine that come from green tea and help lose weight. So that stress, when it stays elevated like that, that is also, I would say, another huge reason why we have diseases in the body is the amount of stress that plays in our lives. So managing stress, I know it's easier said than done, but getting with a good homeopath like Dr. Imran can really, really be helpful in helping the body calm down. And I believe that's it for now. I'll write the other ones in the chat. So I said DIM plus clary sage and a wild yam is good. I like to use those and I see some results pretty nicely. especially if it's more surface level than so it's such deep rooted, like Dr. Imran was mentioning, in some cases where things aren't moving very well, the nosodes probably could help get to those miasms. Okay. Insulin resistance, that again is due to lifestyle and eating habits. So really getting in, I do use some comprehensive homeopathy for blood sugar regulation, but really getting to the core issue of what you're eating, the sugar and the carbs that turn into sugar, like wheat. It's such a crucial role. I think by limiting that, it can really do a big turnaround. You're welcome. Would those work for postmenopausal women? Yeah, I mean, of course, we're all women. So, you know, the estrogen dominance in our culture, especially in the West, is huge with all the plastics and the endocrine disruptors that we put on our skin, the makeup, the laundry soap, the detergent, the everything. This is all you know, the genetically modified soy is another one. This all turns on estrogen dominant genes on, and that is something to consider and keep in mind and lower that intake there from that end. I don't have specific protocols for, if you're talking to me, Karina, I take everybody individualized. So but I have a couple of things here that I mentioned again, like the progesterones plus the Calary stage, DIM, working on digestion, lowering the amount of sugars, stress reduction is a good place to start. Okay, thank you so much for having me, Dr. Imran. And I really appreciate these weekly calls, and I look forward to next week.
So thank you very much. So now I want to say thanks to everyone. So next Sunday, same time, we meet with new topic. So thanks to all. Goodbye, bye-bye.
Thank you, Dr. Imran. Always appreciate your fabulous information.
Thank you very much.